Year one, week four, respiratory therapy school. You've got two tests behind you already now. This week, uh, you learned about medical ethics. Some of those topics would have included things of like such as autonomy, beneficence, non-maleficence, justice, informed consent, confidentiality, veracity, patient's rights. You're probably learning that there's a lot of terms presented with each chapter each week. I don't know how you study best. I always was a fan of flashcards when it came to vocabulary, and it's pretty important to understand those terms and definitions. Ethics is an important part of what we're going to. I mean, this is the chapter in which the week in which the chapter is presented, but ethics is really going to be involved pretty much with everything that you're going to do in healthcare. When you test on your board exam, you're going to be tested in the cognitive domain, the psychomotor domain, and the affective domain. So essentially, what do those items mean? Cognitive domain is, do you know what you're talking about, and can you uh, you know, basically understand and portray that you understand the theory and thought behind what it is that we've taught. The affective domain is, can you emotionally deal with what it is that you're working with? Because you'll be in some fairly stressful situations. I know that you've not gone to the hospital yet for clinical, but once clinical starts, you'll begin to kindly see some of those stressful and be involved in some of those stressful situations. So we'll look at that. Psychomotor domain is, can you know, do cognitive is, do you know it? Psychomotor is, can you do it? And then the affective domain is, can you emotionally handle it? And then there is an ethical component as well. Um, So it's going to be important to understand autonomy, making sure that individuals have the ability to make their own decisions and so forth. And that goes both ways. As a new therapist, soon after you graduate, it may take you a little bit to build the autonomy and establish the rapport with your colleagues to let them know that you are able to function independently and on your own. That's kind of really the whole purpose of orientation going through that. Beneficence, you want to make sure that you're acting to benefit essentially the greater good of the patient and so forth. Non-maleficence, not to do any harm to the patient. Justice, providing fair and equitable treatment for all the patients that you deal with. Informed consent, making sure that an individual is providing their permission after you have provided them instruction. Uh, on what it is that you're going to do for those individuals. Confidentiality, maintaining that individual's privacy, be mindful of the conversations that you're having, statements that you made. You probably wouldn't want to get onto an elevator and have those conversations about the patients that you've been taking care of because you don't know who is around and what type of sensitive information might could be leaked. Veracity is dealing with truthfulness. So to make sure that we are truthful with patients and so forth, but also understanding the conversations that we should have with patients and that we shouldn't have with patients. There are some things that are probably going to be best coming from a physician, and in some cases maybe even a nurse. So just try to make sure that you follow the American Association for Respiratory Care and the state board, your state board licensing board for the um, code of conduct and the ethics that govern respiratory therapy. And then also make sure that you respect and protect the legal and personal rights of the patients that you're going to be involved, so that they do have a set standard of rights. So this was a lot of stuff that we had gone into this week. Some of you will probably may have engaged in some role playing to an extent with trying to uh, provide an example of how these different terms come about. So it won't be terribly long-winded on ethics just because a lot of that's definitions. You're going to have to go over it. For those of you that like to read or those of you that like movies, I will provide some food for thought with some things that would be interesting for you to watch and try to think about it from an ethical perspective, if you will. There is a movie, Awake. Now, this was back in the early 2000s, so I know there's a TV series or what have you uh, that come out, and I think there's another movie recently within the last couple of years called Awake. Those aren't the ones that I'm referring to. This movie, I think, was the early 2000s. and it's about an individual that goes in, he's going to have a heart transplant. However, while this physician doing his heart transplant made it a habit of providing the paralytic, but not providing any type of analgesic or anything of that nature. So that's kind of interesting to watch. There's another movie from the early 90s, The Doctor, recent movie, The Good Nurse, John Q, probably late 90s, early 2000s. And then there's also a movie, You Don't Know Jack. Now, these are not an all-inclusive list. There's a lot of different movies out there, but these are some that come to mind that I've seen in the past that are pretty good to provide some food for thought for ethical perspectives. Because well, along with ethics, there's going to be some end-of-life decision making that'll have to go on and stuff in the future. You Don't Know Jack, if you remember or can recall the individual, Dr. Jack Kevorkian or Dr. Kevorkian, or some people refer to him as Dr. Death. That movie's pretty good. It provides Al Pacino plays Dr. Kevorkian, and there's also some real footage that Dr. Kevorkian had filmed that's actually incorporated into the movies. It just provides interesting food for thought because along with patients' rights and this and that, the rights that we do have, it, an end of life decision making. It's kind of interesting when you start to think about as a patient, does an individual, or not just a patient, but in general, does an individual have the right to die? So that, it brings up pretty good ethical perspectives. I won't share my opinions on things, but I do enjoy reading and seeing different takes, those that are for a certain thing, those that are against it. So I enjoy reading both sides of it, if you will. So movies, provide some movies if you want to, Netflix or whatever, if you can find them. And then read, for those that like to read. Now, this is not an all-inclusive list either, but there's all sorts of different things that, you've got Roe v. Wade, the Tuskegee syphilis trials, or the study that was done, Henrietta Lacks case. You can look at that as well. The Karen Ann Quinlan case, or the Terry Schiavo case, and there's a long list of others that you could, but those are some popular ones that have come up in some textbooks that I've read through and gone over, and have actually used these to discuss some points of ethics and decision making and what have you, and just utilize them in medical ethics in things that I've taught in the past. So that's pretty much what we've done in week one. You continued to work on personal protective equipment, infection control, and prevention. And then now we're going to start to get in a little bit. You've done more with your oxygen cylinder duration calculations. Next week, I'll prepare a short video on air to oxygen entrainment ratios and handling O2 cylinders. But this is pretty much what I've got for you this week. A pretty decent review, I feel like. A lot of studying on your part, a lot of work to go into making sure that you understand those terms, those concepts, and be able to apply it. But I'm doing my best to try to provide a recap of everything, or the highlights of the week, as we move forward. So you've wrapped up your fourth week. I'll see you back in week 5. Thank you for your time and attention.